Ang sakit na iniuugnay sa camel at paniki na mula sa mga bansang nasa loob o malapit sa Arabian Peninsula. Yan ang Middle East Respiratory Syndrome o coronavirus o MERS-CoV. Ibandila mo, Bettina Magsaysay.
Laman na naman ng mga pahayagan ang salitang MERS-CoV. Pero ano nga ba ang ibig sabihin nito? Ang MERS-CoV o Middle East Respiratory Syndrome coronavirus ay sakit sa baga na sanhi ng coronavirus. Ang unang kaso nito ay naitala noong Abril 2012 sa Saudi Arabia.
Battle against an outbreak of Middle East Respiratory Syndrome or MERS continues in South Korea as a 10th death is reported. Workers are spraying subways and other public places with disinfectant. And in the shopping district of Seoul, many of those who venture out wear face masks. But retailers are complaining that panic is keeping a lot more shoppers away.
I'm disappointed with the initial reaction of the government. Because of MERS, the clothing store where I work is going through hard times due to low sales.
The government is now doing a good job. Everything is normal, and it is okay to walk around as usual. The only thing that worries me is the decreased number of overseas visitors.
More than 2,700 schools remain closed and nearly 4,000 people are in isolation as the government announces new quarantine rules for those who may have come in contact with the virus.
There's been a sharp increase in the number of people with Middle East Respiratory Syndrome in Saudi Arabia. The disease kills about 1 in 3 patients. Healthcare workers around the world are watching closely. Should people be worried? This is Inside Story. Hello and welcome to the program. I'm Mike Hanna. There's no cure and it's spreading. Middle East Respiratory Syndrome, or MERS, has killed more than 100 people since it was first discovered in 2012. On Sunday, another 10 patients were reported in Saudi Arabia, raising concerns across the region. Tarek Baisley explains.
Middle East Respiratory Syndrome, or MERS as it's become known, is a so-called coronavirus from the same family as the flu. It causes coughing, fever and pneumonia, and in just over a third of reported cases it's caused death, often in the elderly or people who are already sick. It was first reported in 2012 and until 2 weeks ago around 200 cases had been identified, most of them in Saudi Arabia and other Gulf countries.
The MERS coronavirus, dubbed a threat to the entire world by the World Health Organization this week, has killed 3 more people.
The 3 latest victims of the new SARS-like respiratory virus died in a hospital in Saudi Arabia's capital. Health ministers say they ranged in age from 24 to 60.
This is of grave concern to us here internationally in WHO because there are so many unknowns around the virus, which so far has killed 55% of the confirmed cases.
All of the 3 recent patients had chronic diseases and were admitted into the hospital months ago. The 3 deaths bring the most recent global death toll from the Middle Eastern Respiratory Syndrome, or MERS, to at least 30. A number of others have become sick with the virus. There are no reported cases of the virus infecting anyone in the United States yet, but the virus, which is believed to have originated in Saudi Arabia, has been reported in France, Germany, and the United Kingdom. The symptoms of the disease are flu-like, beginning with a cough and chills, but then becoming increasingly worse. Scientists believe it can also be transmitted by human-to-human interaction. The disease is believed to be part of the SARS family, which spawned another worldwide outbreak in 2003.
The World Health Organization says it has significantly increased concern about the deadly new Middle East respiratory virus, but the disease is not a global health emergency. The virus, which causes coughing, fever and sometimes fatal pneumonia, has been reported in more than 500 patients, mainly in Saudi Arabia. It has spread to neighboring countries as well as in a few cases to Europe, Asia and the United States, killing about 30% of those who are infected.
so much for that report, Chian. Meanwhile, President Park Geun-hye held discussions with global experts about improving Korea's handling of new infectious diseases like MERS.
That's right. As information on such illnesses are limited, specialists from the World Health Organization and the U.S. CDC say even medically advanced countries like Korea should be well prepared to respond. Our Chae-Yu-sun reports.
Admitting that Korea lacked preparation to prevent the entry and spread of the MERS virus, President Park Geun-hye sought the visiting international experts' advice on ways to enhance the country's response to foreign diseases. One
disease has appeared for the first time in the U.S. It's called Middle East Respiratory Syndrome, the MERS virus for short. The Centers for Disease Control says MERS turned up in Indiana, where one patient recently back from Saudi Arabia is being treated.
Until now, the virus has been seen only in the Middle East and Europe, a dozen countries in all. About 100 people have died from it. Here's Dr. John Lapoog.
The unidentified patient was a healthcare worker in Saudi Arabia. On April 24th, he flew from Riyadh to London and on to Chicago, then took a bus to Indiana. 3 days later, fever, cough, and shortness of breath developed. The next day, he was admitted to Community Hospital in Munster, Indiana. The patient's travel history led the state's public health department to test for MERS. Dr. Ann Schuckett is with the CDC.
We are working with partners in England and with others around the world to make sure that the people who were on the airplanes are contacted and notified to be on the lookout for signs or symptoms.
Middle East, the lands around the southern and eastern shores of the Mediterranean Sea, encompassing at least the Arabian Peninsula, and by some definitions, Iran, North Africa, and sometimes beyond. Economically, the Middle East is known for its vast oil reserves. It is also known as the home of the three major world religions, Christianity, Islam, and Judaism. Because of its economic, religious, and geographical location, the Middle East has been at the center of many world issues and political affairs. The healthcare structure is well developed. It consists of both public and private healthcare systems. Turkey is a very popular destination for medical tourists from the Middle East and other parts of the world, as the healthcare services provided there are high of quality and affordable. Hello everyone, for today's video we are going to discuss MERS-CoV. First, what is MERS-CoV? Middle East Respiratory Syndrome is a viral respiratory illness caused by a coronavirus called Middle East Respiratory Syndrome coronavirus. It is a zoonotic virus, meaning it is transmitted between animals and people, and it is contractable through direct or indirect contact with infected animals. MERS-CoV has been identified in dromedaries in several countries in the Middle East, Africa, and South Asia. The earliest MERS-CoV was reported in April 2012 in Saudi Arabia. It is not the same virus that caused severe acute respiratory syndrome, or SARS, in 2003. However, like the SARS virus, MERS-CoV is most similar to coronavirus found in bats. Recent studies have shown that MERS-CoV was detected in camels, and one infected camel case has been linked to a human case. However, the route of infection is still unknown. As of today, there are a total of 27 countries that has reported to have cases since 2012, leading to 858 known deaths due to the infections and related complications, and 80% of these cases have occurred in Saudi Arabia.
The risk factors of MERS-CoV. MERS-CoV is a coronavirus. Coronaviruses are a large family of viruses that cause respiratory illnesses, including the common cold. These viruses are zoonotic, meaning that they commonly infect animals and can transfer to humans. Research suggests that MERS-CoV originates in bats It then likely spread from infected camels to humans. And according to the World Health Organizations, most cases of MERS in humans have been transmitted by people in healthcare environments. However, evidence suggests that camels could also be a source of infection in humans. The virus does not seem to pass easily from person to person unless there is a close contact, as in a healthcare setting. These are the following groups of people that are most susceptible to MERS-CoV infection and complications. First are the older adults, people with health conditions such as diabetes, chronic lung disease, kidney disease, and cancer. Also, some people with weakened immune systems such as those receiving chemotherapy or immunosuppressant medications, and most of those who have died from MERS had pre-existing chronic medical conditions.
For the continuation, I am Aika Sagyawan Hagin.
I am Kayla Bumidang.
Presenting to you the pathophysiology of Middle East Respiratory Syndrome, coronavirus, or commonly known as MERS-CoV. To begin with, MERS-CoV is a form of beta coronavirus family which has 4 major surface proteins including the spike, membrane, envelope, and nucleocapsid proteins. For the mode of transmission, it can be either zoonotic transmission or from animal to human and human to human transmission. The virus can transfer through air, bodily fluids or droplets, and through direct contacts.
MERS-CoV affect mostly the respiratory system and kidney. First off, I will be discussing its effect to the respiratory system. MERS-CoV infects and replicates in the human airway, epithelial cells, and suppresses the production of interferons. Since MERS-CoV can efficiently replicate inside macrophages, hence it can overcome the host immune system. These phagocytes act like reservoirs and means of transportation for these viruses, helping to replicate and disseminate. Next, MERS virus interact with the host, the peptidyl peptidase 4 receptor, through its spike S protein after entering the respiratory tract. Since DPP4 receptors are present on the epithelial surface of various human organs such as the lungs, kidney, liver, bone marrow, thymus, and intestines, the systematic distribution of DPP4 facilitates the dissemination of virus in the human body. Thus, it affects the lungs, wherein there is an increase of inflammatory secretion of the lung leading to pneumonia, bronchiolitis, bronchitis. Normally, macrophages are cells of the innate immune system, which help remove the pathogenic substances from the body and present their antigens to the T cells. The cytokines, as well as chemokines produced by macrophage, help in destroying the pathogens, adjusting the immune system, and maintaining tissue homeostasis. However, in MERS, virus-infected macrophages play a significant role in the development of illness symptoms. Infection of human epithelial cells with MERS-CoV causes the production of pro-inflammatory chemokines and cytokines from monocytes derived from macrophages.
Moving on, as the virus affects the kidney, it will result to renal failure with the involvement of epithelial cells and podocytes. These podocytes, together with endothelial cells of the glomerular capillary loop and the glomerular basement membrane, they will now then form the filtration barrier. After that, the general effect of the kidney will be tubular necrosis and acute tubular necrosis, causing the proteinuria that causes the blockage of renal tubules. That's all for the pathophysiology of MERS-CoV.
So, next naman is yung PCR or yung polymerase chain reaction. So, polymerase chain reaction is a molecular test that can be used to detect viral RNA in clinical samples. So, basically, it is the respiratory sample like throat swab or fluid from the lungs. So this test identifies the virus based on its genetic fingerprinting. So, genetic fingerprinting, ito yung we are obtaining or comparing the genetic fingerprints for identification. So, ito yung gaya ng ginagawa ngayon sa COVID-19, yung RT-PCR or yung real-time polymerase chain reaction. So, by doing this, dito natin malalaman kung positive or negative tayo sa virus. So, dito meron tayong 4 steps. First is yung denaturation. Dito yung tube is being heated to at least 94 degrees Celsius using a thermal cycler. Second is annealing. So, denaturation, annealing. Dito naman, yung mixture is being cooled to between 50 degrees Celsius to 60 degrees Celsius. Third step is the extension. So, denaturation, annealing, extension. So, dito naman, so once joined together, kapag nag-join together na yung mixture natin or yung sample natin, there is a new duplicate wherein a double-stranded DNA molecule has been formed. So last step is the analysis with electrophoresis. So first is denaturation, second is annealing, third extension, and fourth is the analysis with electrophoresis. So, sa PCR lang, we need to know that the polymerase chain reaction is very precise and it can be used to amplify or copy a specific DNA target from a mixture of DNA molecules.
The clinical manifestations of MERS-CoV infection ranges from being asymptomatic or no symptoms to mild and severe. Most people with confirmed MERS-CoV commonly show symptoms of fever or hyperthermia, which is defined as the temperature greater than the normal range. This is caused by the increase in white blood cells in response to the infection. Another common symptom is coughing. Coughing is a protective mechanism in the body in which it expels foreign organisms and maintain the airway clear for efficient carbon dioxide and oxygen exchange. Dyspnea is also known as the shortness of breath, which is actually a sign of continuous damage to the lungs that can lead to acute respiratory distress syndrome.
MERS-CoV may also manifest as pneumonia as a secondary infection. MERS-CoV may cause severe inflammation in the lungs, and alveoli may fill with pus and fluid that it may become hard to breathe. Hence, pneumonia may occur with this condition. Gastrointestinal symptoms may also occur, and that is because the coronavirus may continue to replicate and invade the gastrointestinal tract, leading to the impairment of its function. Gastrointestinal symptoms include diarrhea as well as nausea and vomiting. In severe cases, this may lead to respiratory failure that patients may require mechanical ventilation or support in an intensive care unit. In addition, there are also groups which are vulnerable or at high risk of acquiring this disease. These groups include the elderly group, people who are immunocompromised, and with chronic conditions such as cancer, renal disease, and cardiovascular diseases.
This respiratory infection is managed by supportive interventions such as hydration, administration of antipyretic, analgesics, respiratory support, and antibiotics if needed for bacterial superinfection. Other medical care depends on the severity of illness. There is currently no specific treatment and no vaccine to protect people against the disease. However,
Drugs that provide relief from fever and muscle aches are given, such as acetaminophen or other NSAID such as ibuprofen. Nursing management includes the following: monitoring the patient's vital signs, especially the temperature and respiratory rate, since infection usually begins with a high temperature and shortness of breath is another common symptom. Educating the patient and their family about the patient's condition and the management of the disease is important for them to understand the disease process, the safety measures to apply, and how to protect themselves from acquiring the disease. Reducing increase in temperature is essential to decrease body temperature and promote relief. This can be done by adjusting and monitoring environmental factors like room temperature and bed linens as indicated. Encourage ample fluid intake by mouth, eliminate excess clothing and covers, and give antipyretic medications as prescribed. To ensure patent airway, we can teach the patient on proper ways of coughing and breathing. For example, taking a deep breath, holding for 2 seconds, and cough 2 or 3 times in succession. Also position the patient upright if tolerated, and encourage patient to increase fluid intake 3 liters per day within the limits of cardiac reserve and renal function. Lastly, we can use our presence, touch with permission, verbalization, and demeanor to remind patients that they are not alone and to encourage expression or clarification of needs, concerns, unknowns, and questions. We should accept their defenses and be able to understand their situation. Using simple language and brief statements can also be helpful. Also, we should allow the patient to talk about their feelings and evaluate them to provide appropriate care.
As Harry J. Johnson said, the human body has been designed to resist an infinite number of changes and attacks brought about by its environment. The secret of good health lies in successful adjustment to changing stresses on the body. Our bodies having their own defense mechanism does not mean that we should be lenient when it comes to maintaining our health. And having a healthy lifestyle can prevent long-term illnesses and help us live longer. Therefore, if we do not want to acquire such conditions, we should follow proper hygiene, etiquette, and maintain a healthy lifestyle. This is Section NCB Group 2, and thank you very much for watching.